Hello friends, welcome to my channel Dietetics Notes. Today I am going to discuss on topic esophagitis, its types, symptoms and dietary management. Let's start. So friends, first we will know how esophagitis occurs. As we know that esophagus is a muscular tube which is 25 centimeter long and basically helps in transporting the food from the mouth to stomach. So the role of the esophagus is to transport the food from the mouth to stomach. And esophagitis occurs when our esophagus gets irritated by the acidic gastric reflux to the esophagus mucosa. See, this is the esophagus, and when this esophagus gets inflamed, the inflamed condition is called esophagitis. Esophagitis can be of two types, acute and chronic. Acute is a short-term esophagitis and chronic is the long-term esophagitis. And the symptoms of esophagitis are heartburn, dysphagia. Dysphagia is also called when there is a difficulty in swallowing, then it is called dysphagia. Now we will learn what are the types of esophagitis. Esophagitis are of two types. One is acute esophagitis and the second is chronic or reflux esophagitis. Here you can see the definition of acute esophagitis. It is characterized by substernal pain on swallowing. It is due to prolonged intubation, extensive burns, excessive vomiting, ingestion of toxin, chemical, or due to diphtheria. So friends, acute esophagitis is of short-term esophagitis which can be happen through extensive burn, through acid reflux, or can be excessive vomiting, can be through of excessive vomiting, or if someone has ingestion some toxic thing, then also our esophagus got inflamed and it can occur esophagitis. So the another type is chronic or reflux esophagitis. So friends, chronic and reflux esophagitis is a long-term esophagitis. In this, our tube got inflamed by long-term like acid reflux, or it can be characterized by intermittent heartburn, pain in taking hot and cold liquids, spicy or acid food, and it can be the result. It can be from the result of recurrent gastroesophageal reflux due to hiatus hernia, reduced lower sphincter pressure, decreased abdominal pressure, and maybe a cause of abdominal pressure can be decreased, maybe of pregnancy, obesity, and hiatus, and increased abdominal adiposity and recurrent vomiting. So, if suppose someone has recurrent vomiting or someone has eaten some thing like toxic thing or chemical thing, or someone has excessive vomiting through any disease, then also our esophagus get inflamed, and the person get esophagitis. Now, friends, we will know what are the dietary managements we can follow when we have acute hep- esophagitis. So, in acute phase, the dietary factors to keep in mind are that we have to take liquid diet, it should be small, and frequent meals we have to take. Less abrasion to the esophagus, thus avoiding orange juice and other citrus and tomato products because of the acidity. Suppose if someone has esophagitis, so he or she should avoid the orange juices and other citrus and tomato products because these citrus products produce acidity and acid reflux, and it can worsen the situation of esophagitis. Spices like chili powder, black pepper to be avoided, and the person who has esophagitis should avoid chili powder and black pepper. Now we will know the dietary management in chronic phase. If someone has the chronic esophagitis phase, in that case, what should we do? In chronic phase, the person must take the food which increase the LES. What is LES? LES is the lower esophageal sphincter. Meals food in high protein increase sphincter pressure and reduce the likelihood of heartburn and acid reflux. The person should take the meals which are rich in protein because protein increase the sphincter pressure, and sphincter is the valve which is in the down connection of esophagus to stomach. The like it's a valve which connect the esophagus to stomach, and when the this valve gets loose, then acid reflux happens. So we have to eat that food which increase the pressure of this esophageal sphincter, and in that case the valve will tightly hold that part, and acid it will reduce the acid reflux. So the person with esophagitis should avoid chocolate, alcohol, caffeine containing beverages like coffee, cold drink, fatty foods, and increased fat intake. So person should avoid alcohol, caffeine, chocolate, and increased fat food. Patient should not contain any food before 3 hours lying bed. Suppose if someone has esophagitis, he should avoid eating eating like three minimum 3 hours gap he has to kept before sleeping or lying on the bed. Avoid lying down, bending, or straining immediately after eating. Suppose the person who is suffering from esophagitis should avoid bending and straining immediately after eating. Reduce weight so that the abdominal pressure decrease. And if the person is overweight, he or she should reduce their weight to increase to decrease the abdominal pressure. Avoid tight-fitting clothes and avoid smoking as nicotine decreases ileus pressure. So, smoking also decreases the ileus pressure. So, it is recommended the person to not smoke. Sorry. So friends, thank you. Hope you like the video. If you want to know more about any topic, you can comment me, and I will make more videos on that. Till then, thank you. Bye bye and take care. Please like and share and subscribe my channel. Thank you.